Biden, and Walter Isaacson, President and CEO of the Aspen Institute.
Thank you so much for being here.
I miss Tom Friedman.
Your wife was, there's Tom right there, John Doerr, Tom.
Tom, you have a wonderful daughter.
Yeah. And Tom,
my dad used to have an expression. He'd say, you know your success as a father, you look at your kid and you realize they turned out better than you. She's better than you, kid. She's better than you. I'm a success as well.
And if Orly's wondering what her knapsack is, it's in my office because they wouldn't let her bring it in because she had juices in it. Well, thank you for being here. The Vice President, everybody knows much about him, but what you most know about him is he actually cares about every person in America, gets up, has that instinct that every working and middle-class person needs to be part of our prosperity. I've heard him talk about this since 1973 or so when you entered the Senate. And so once again, let's give him a warm Aspen welcome. If we could, I'd like to start with what the President most recently tasked you to do, which is this moonshot on cancer. It wasn't something you knew a lot about, except for from a deeply personal perspective. Tell me what you've learned, what we're doing, how we're fighting cancer now.
I'd like to ask one question before I begin. Nudie, going to do it?
No,
all right, that's okay. That's all I wanted to know. I just want to get to the important things out of the bat.
And
I think he needs the help, yes.
The question was, should I?
Should he be vice president? I tell him. Anyway, it's a hell of a job. Get a big pay raise, it's all work. Anyway, I'm sorry. You asked a serious question.
No, actually, right before, because that's not bad. Should he, not just Speaker Gingrich, but should somebody be? I mean, is there something you've really shown what you could do as vice president?
I don't know about
Tell me about that job.
Well,
tell
you
Newt
know,
about the job.
As Newt's buddy sitting to his left's an old friend of mine too. The damn Republican, but I love him.
And Corlogus, our former chair.
But all kidding aside, when I was asked to consider this by then Senator Obama, when he was the presumptive nominee, I actually thought I could help him better by not doing it, by staying in the Senate. And he said he needed an answer right away, and I told him, no, I don't want to be considered. And he said, how much time do you need? So I went home and talked with my family. He asked me to go home and talk. And then Jill was right that I should do it. It's been the most rewarding thing I've done, only for one reason. There is no inherent power in being vice president. None, zero. It totally, completely, thoroughly depends on your relationship with the President of the United States, whomever that vice president is. And the great benefit for me is that in the 13 debates we had seeking the nomination, he and I are the only two that never disagreed in principle on any specific, on any issue, tactic we disagreed. He's been an absolute man of his word. He asked what I wanted, if there was any one request to do it. I said, I just want to be the last guy in the room. I mean, not figuratively, literally, the last person in the room. He's president, he makes the decision, but after all the years I spent in the Senate, I wanted an opportunity to try to affect the outcome of some of these vital decisions. And he's been absolutely, thoroughly consistent. And the interesting part is he said it a different way, as only the president could say. He said, to my surprise, we became great friends. I said, you know, but he has become a very close personal friend. And what's made it all work is our families are close. My number 3 granddaughter and his number 2 daughter, each other's best friend. They vacation together. They're in the same school together. They're the same teams together. Jill and Michelle are good friends. So it's worked out really well because he's been inclusive. But there's no, and the other thing I found, and I think Newt would agree with this because he's studied it, the job of president is so complicated these days that there's no one woman or one man that can do it without being willing to trust someone else to give them major responsibility. And so therefore you have to have a genuine relationship. You have to be on the same page. And so when we did the Recovery Act, which I know a lot of folks didn't like, I think was a great success, the president just said, do it. I never once checked with him. I never went back. He gave me control over the cabinet. The same with other things we've done. So it's not because anything special about me. It's just the job is so big. And it's gotten so broad, and the world has changed so drastically. You really need someone who is value-added. So I wasn't kidding. Newt and I disagree, but he's one of the brightest guys I know. He knows the government, he knows the issues, and I would feel better, even though we disagree philosophically. No, I'm not being facetious. I'd feel better knowing that there was somebody there with the depth and gravitas on the issues that Newt possesses. There are others who possess it as well. So that's a long way of saying that the relationship, the personal relationship, really, really, really matters. Trust matters. And what I've been able to do because of his trust, when I've traveled 1,200,000 miles around the world. Tom and I have talked about this. When I show up with another head of state and I say something, they know I speak for the president. There's no one wonders. No one wonders. Some of my colleagues in the Senate wonders if I say something in the House or Senate. And it's not because of me. It's because he said, I have this relationship with Biden. Biden speaks for me. And if you do it well, and I hope I've done it somewhat well, it can be value added for the president.
Right. Well,
I never looked for this job, though.
I know,
but I never ran for vice president.
We will know in 2 weeks whether your endorsement today of Newt Gingrich as vice president will help his chances or destroy his chances to be the vice presidential running mate.
I want to make it clear. I want to make it clear. Donald, I am not endorsing. I'm not. I'm just saying he's bright as hell. I disagree with him, though.
Let's go back, if we can, to the moonshot. Explain what the moonshot is.
Well, look, the moonshot, one of the things that I sometimes almost regret we called it the moonshot because, Kennedy and Nixon talked about a moonshot, and people expect that there's some kind of epiphany that's going to occur, and there's going to be a breakthrough on all cancers. We're going to cure cancer. That was never what this was about. The way this came about is I said when I announced I wasn't running, and Newt, I found out you want to be popular, announce you're not running for president. I would, if I'd known this, I would have announced every day I'm not running. But I said, and it was more wistful, Walter, than anything else, I said in the Rose Garden, but I would have liked to have been the president who presided over a fundamental change in cancer. And the reason I say that is we've reached an inflection point, and some of the real experts that are in this audience know it. We've reached an inflection point that didn't exist during Nixon's time. For the first time, I learned when our son, Jill and I, when our son was going through what he went through, that up till 5 years ago, immunology was like it was out in the wilderness. No one paid any attention. There was very little collaboration and cooperation between virologists and immunologists and genomic science. I mean, there was none of that. There was no collaboration. But now there is. It's only just beginning. It's beginning. There's a lot more to do, but the difference between when Nixon announced it now, we've mapped the human genome. We're in a position where immunology is making significant strides. We have cooperation with all. We have everyone from mechanical engineers to biochemists to that are engaged in the enterprise. And it's, for example, when Nixon announced it, we had no idea there were 200 different cancers.
Nixon announced a war on cancer.
I'm sorry, I beg your pardon.
Ago.
I beg your pardon. And so what we've decided, the president and I, is that he decided was that I believe we could make 5 years of progress what otherwise would take 10 years. Even if we didn't have another single major breakthrough. If we take all the information we have available to now, better organize it, correlate it, share it, change the way the federal government operates, its various agencies, the way everything from the FDA to the NIH, the way the drug companies move, the way in which we do dual trials, the way we share information. For example, now we can do, I know you know this because you've written about it, we can do a million billion calculations per second. And so the ability to find patterns of why cancers form, why a cancer cell develops, how it metastasizes, give me an example. There was a study done, I think it was with 1,400 women on Medicare on ovarian cancer. And they used one therapy on all of them, and only a handful benefited from the therapy. And they're trying to figure out why that was the case. But because there were only 1,400, they went back and they aggregated all the health records, the backgrounds of these women, what other medicines they were taking, what their lifestyles were, et cetera. And to oversimplify it, what they found out was those women who were taking a statin while they were taking this anti-ovarian cancer drug, they did the best. They did the best. Now imagine with our ability to sequence the cancer genome. Imagine if we're able to aggregate the biopsies that have been done on cancer. Imagine if we can aggregate the lifestyles, the treatment process, et cetera, all in one place. We had 2 million, 5 million, 10 million folks in that one spot. The ability of these supercomputers to go in and find patterns, to find out what it is in terms of everything from lifestyle to what other drugs you're taking, to find answers as to why so many people, all of you know somebody who has suffered from cancer. All of you know somebody, and maybe some of you, who are dealing with fighting cancer. And you know people with the same exact diagnosis taking the same drug, 2 different outcomes. Imagine if we were willing to share this data. Imagine what we could do. And so there's a lot of breakthroughs that are possible, but we have to change sort of the culture a little bit.
Let me push on that a bit, because for that to work, you have to be able to be counted into a big database. HIPAA makes it very hard to share electronic medical records. It's difficult for me even to get my electronic medical records, from Washington out here. Why haven't we been able to break the back, as Eric Lander said earlier this week, as Sylvia Burwell said earlier this week, break the back on big data and getting our data in if we want it?
Come hell or high water, I'm going to break the back.
Yes.
No, not a joke. Because
no, I mean, it's important.
Because what's happening here is, look, I'll try to be delicate.
Don't.
The culture of medical research does not rest on sharing data and information, number one. And it's not, by the way, they're all good guys and good women. It's just the way in which it's developed over the last 100 years, number one. Number two, you have, when I keynoted the Davos this year and I was asked, though, before I would do that, would I have a roundtable on cancer? And I had two Nobel laureates at that round table. I had a number of folks of heads of major hospitals, and they started talking to me about how there's Orion, there is CancerLink, there are a number of these new organizational structures where you have philanthropy and major hospitals
Yeah, why not give you this? Yeah.
that have major hospitals And what they're doing is they're correlating data, all the data they have in one place. And so I asked them all to come visit me, and I won't mention them all, but 5 where close to $1 billion is being spent to aggregate this data. And I said, tell me what you're doing. And I sat in the ceremonial office of the Eisenhower, and they all told me what they're doing. And I said, well, it sounds like you're all doing the same thing. I'm not being facetious. And they all kind of put their heads down. And I said, wouldn't we make a hell of a lot more progress if it was all open data, if you shared it all? And the answer was, yeah. And after we broke up, and 2 of the heads of these major outfits came up to me and said, keep the pressure on. I can't do this myself. I mean, I'm not able to, you know. So there is a growing recognition on the part of the major, I've visited now 10 or 11 of the major cancer centers in America, in the world, but they're in America. I've spent a better part of a day at each one of them. I have I've spoken to over 9,000 cancer researchers, and these 2 large organizations represent them. I've privately met with over 280 of the leading virologists, oncologists, immunologists in the world, and they all privately say basically the same thing. They say that we're not sharing data well enough, and if we did, we could exponentially increase the potential to find answers to a whole range of questions relating to cancer therapies. Number 2, they say that it is very difficult to be able to do dual trials with different medicines. You represent one drug company, I represent another. A bright young researcher says, I think the combination of those 2 could really have a potential impact, and it does. They say that there's no way, if any of you have gone through it, where if you want to find out whether you can get in a cancer trial, there's no place you can go to find out every cancer trial that's going on in the United States. Hell, I can get on, you can get on, Uber can tell you exactly where everybody is, how to, I mean.
Well, let's pick that one. How do we get more people access to information about getting into cancer trials?
Well, here's what we're doing. We are changing. We're going to have at NIH, we're having a new website. I knew you'd ask me that, so I can't remember what the hell the name of the website is, but
Greg, what's the website?
But we'll, as I say, get it to you. But there's going to be a new website where we are going to aggregate every single solitary trial that takes place in the United States of America. Because here's what happens. If you don't live near a major cancer center, you don't live near MD Anderson, or you don't live near the Hutch, or you don't, I can name them all, and you're an oncologist in a rural area in the Midwest or anywhere in the country, you have a patient you diagnose with a particular cancer, and you want to get them in a trial, you have no idea how the hell to get them associated with or tied up with or connected with that trial. So there's going to be one place, we're in the process of putting this site together now, and that NIH is, where you can click on and you can find out what every trial for every type of cancer that's being conducted. It's also a helpful thing for the pharmaceutical companies. They have trouble finding people to be in their trials. And the perception is that people don't want to give their information. Well, they're much more ready and willing to give their information, and it can be done and your privacy protected very easily. But up to now, there's been no willingness to decide there's going to be one site, one place. And
in return, should the pharmaceutical companies try to keep a lid on these $100,000 a year drugs?
Well, that's not necessarily related, but yes, they should try to keep a lid. But look, in fairness to the companies, they drill a lot of dry holes. They spend a lot of money doing a lot of tests that cost tens of millions, hundreds of millions of dollars. They get no return on their investment. But there's some place between the sweet spot between a legitimate return on your investment and holding hostage people who need the drug to live but can't possibly afford the drug. For example, there is one particular drug that's been very, very helpful. I don't want to pick on a particular company. One particular drug that's been very helpful